It's with great delight a new chapter in our campaign to rid Edo State of the dreaded COVID-19 pandemic, which, as you know, has wreaked havoc across the world and changed the way we live and interact with each other. There is no denying that the last few months, specifically the last 1 year, have tested our resolve as a people. And it is heartwarming that today we begin a march to the gradual return to normalcy with the introduction of the coronavirus vaccine, which assures of hope of brighter days ahead as we collectively fight to defeat this deadly virus. It is therefore indeed with great pleasure that I formally flag off the COVID-19 vaccination exercise in Edo State by taking the first dose of vaccination personally this morning. This exercise has started today and will continue through the week, and during this time we intend to get the vaccine to people in the front lines in our hospitals and other relevant health facilities. Also, we will vaccinate leaders and key stakeholders in the society to bolster public confidence in the efficacy of the vaccine. The main objective of the COVID-19 vaccination exercise is to accelerate the spread of herd immunity, which will ultimately slow down and interrupt the transmission of COVID-19 in the state and in the entire country. We have 81,080 vaccines, which we will be administering in 2 doses. This means that we are looking to inoculate not less than 40,000 people in the state in this first phase. The importance of this exercise cannot be overemphasized. It is particularly our frontline workers and the elderly and those who are living with comorbidities. This occasion is to sensitize residents in the state and create more awareness on the safety and importance of this vaccine. At this juncture, let me explain why we didn't start on time, but we started about an hour late. As at this morning, when I was coming into Benin from Lagos, I received no less than 10 messages advising that I should not take this vaccine, that it wasn't safe, and some of these messages came from abroad, and that there are so many countries where this particular vaccine has been put on hold and it's been checked and tested. That in South Africa, for instance, the doses meant for them have been rejected, and so the vaccine manufacturers are pushing it to Nigeria. So I had to call the experts. Fortunately, as you know, Edo is very, very blessed and well placed with human capacity that understand the issues in this area. And over the last 1 hour, we've exhaustively gone through all the so-called risk issues relating to this vaccine. And yes, it may not be 100% foolproof. Yes, there may be some issues, because, the more than how many billion people on earth cannot have the same constitution. However, on the balance of risk, this vaccine is safe. We understand the politics of vaccination, particularly as it relates to this. When the polio vaccines were introduced several years ago, the same sort of fears were expressed. The same sort of uncertainties were expressed. However, the world went ahead with vaccinating against polio. It may not have been 100%, but today we've been able to kick out polio from our society. So there's nothing new with this vaccine and the politics of the vaccine. And I decided this morning, against all pressure, to make myself available to take the vaccine. And I have done so. It's a painless exercise, and I'll be surprised if there will be any side effects. So I am encouraging all of us in Edo State to disregard, or not disregard, but yes, listen, but to the fears being expressed, but however, go ahead and take your vaccination, particularly our frontline workers who are daily exposed in treating COVID-19 patients, and also the elderly and people who have underlying medical conditions. Please go and ensure that you take your vaccines. We have doses for 40,000 people to be vaccinated immediately, and I have asked that we are proactive. That is, we'll go to the communities. For people who you know are elderly, people who you know have underlying health conditions, let us know. Get them to register so that we can vaccinate them. That's the only proven way today that we can reduce their risk of being exposed to COVID-19. I want to thank all the leaders who are here this morning, from the executive, the legislature, and the judiciary, both domestic and national, and more importantly, our religious and community leaders who are here. Life has been very, very difficult for us in the last 12 months, as you know. And finally, we are seeing the light at the end of the tunnel. I want to use this opportunity to thank each and every one of you for the commitment. Every time I called out, every time I wanted a meeting to solicit your support in our fight against COVID-19, you've always been there for us. We want to really, really appreciate you this morning. I want to appreciate the COVID-19 team, the medical team in Edo State. You have just been exemplary. I'm very, very proud of the team we have put together that has helped us respond to COVID-19. Our response from Edo has been unique. We've dealt with COVID-19 as a public health care emergency, and we pulled every resource we have in the state. We did not see a difference between the state hospital system or federal hospitals or private hospitals. We brought everybody together to work together in this response. And we were fortunate that we had leadership provided by our partners, the WHO, Africa CDC, Nigerians, the NCDC, and all the other partners who worked with us over the last 1 year. We want to thank you for the commitment that you've displayed. I am also very proud of the work you have done. It's been documented, and it is classic. We've done, this time will not allow me go through the successes we've achieved. A couple of weeks ago, I got a call from a very senior official in Abuja who said, "What is happening in Edo? Your mortality rates from COVID-19 is the highest in the country." I said, "Yes, because we've been very transparent. We got a team to undertake an analysis of our response. Why were the deaths that high? And you could explain it. Because we were testing more at health facilities. People who were already ill and were coming for treatment, we tested first if they had COVID. And naturally, the people who were already sick, they came into the clinics, and many of them who had comorbidities did not survive. So it doesn't take a rocket scientist, therefore, to see why our morbidity rates are high. or were high. But the interesting thing is that any curious analysis of the data will see that what we did in Edo, or what we are doing in Edo, the data we are producing correlates with what is happening in other parts of the world. So I'm very proud of the work this COVID-19 team has put in the last 1 year, and to assure you that we will continue to support our fight and our response against COVID-19. But more than anything else, this response has now opened our eyes to the potentials that we have in the healthcare industry in Edo State. The quality of manpower we have is world-class in Edo State. Edo today enjoys the highest ratio of doctor to population ratio in Nigeria. And as a government, we intend to capitalize on it and make Edo State the health capital of this country. Let me end this speech by using this opportunity to thank Mr. President for this initiative, which has led to us being given these vaccines free of charge. I want to thank our son, the Minister for Health, Dr. Ihanire, all senior members of and officials of the Presidential Task Force on COVID-19, the Director General of NCDC, and all of those Nigerians who have been working tirelessly to make sure that as a country we are able to cope with the public health issues that have arisen as a result of COVID-19. I want to thank everybody who has come in here this morning, and to advise and ensure that you all take your jabs before you leave this hall this afternoon. Once again, thank you very, very much.
Thank you so much, Your Excellency. Please a round of applause for that very, very strong message of hope. That speech is like a sack letter to the vaccine introduction has been